Hello everyone, welcome back to our next video on our YouTube channel. I am Dr. Zini Sadhakiran, Senior Consultant Obstetrician and Gynecologist. In our last couple of videos we've been talking about periods, and today I want to carry on and talk about heavy periods. Sometimes ladies are getting periods in which the flow is too much and they are losing a lot of blood and needing to change their pads or their tampons very frequently, say every 2 hours, every 1 hour, and they're in fact soaking through those pads and tampons. In this situation, there could be a number of causes which could be causing this. One, there are certain tumors in the uterus which develop, which are called as fibroids. So fibroids are tumors which grow from the muscle of the uterus, and most of the times these are not cancers, which means that they do not have the potential to migrate or move around in the body and spread like a cancer. But they can grow in size, and then they can grow to very big size whereby the uterus becomes as big as a term 9 months pregnancy, so they can be up to the limit of the lower rib cage. So fibroids, when they are present, they are very notorious for causing heavy periods. Usually they are not associated with pain. If they are very big in size, of course they will have a mass or a pressure effect, like they would be pressing on the bladder, so a person might feel that she needs to go and pass urine more frequently, or she might feel there is a difficulty in opening her bowels or going to the toilet to pass motion. Fibroids can also be causing a problem with a lady to conceive or have a child when she is planning pregnancy, especially if they are pushing inside the lining of the uterus. Fibroids can be located anywhere in the uterus. They can be either out towards the outer wall, totally embedded in the muscle of the uterus, or pushing towards the lining of the uterus, and they are named as subserosal, intramural, or submucosal. Submucosal fibroids, even if they are small, say 2 to 3 centimeters in size, they can be very notorious in causing heavy periods. So these kinds of fibroids usually will need dealing with, even if they are small. They can be removed with several laparoscopic or keyhole surgery techniques. We can use a camera putting inside the natural opening of the uterus and remove it hysteroscopically. Or we can do a laparoscopy and remove the fibroids through the abdomen without making a big cut, and then we cut the fibroid into smaller pieces and remove them. So fibroids are something which need to be dealt in various ways, depending upon their location, depending upon their size, depending upon what the patient's desires are for having children, and all these things will matter. Very small fibroids can be ignored if they have been incidentally found on a scan. So say somebody had a pain in the tummy, she went for a scan and they found that she's got a small 1 or 2 centimeter fibroid which is not disturbing the lining of the uterus. These can be left alone and just be monitored with ultrasound scans, say in about 6 months or so, just to make sure that they're not growing in size. Very large fibroids, usually over 7 centimeters in size, will need dealing with surgery. There are few medications which are said that they help in reducing the size of fibroids, but we have not found them very successful, but can definitely be tried, especially when we are waiting for somebody to try IVF and they have a very small fibroid. Then sometimes they have been tried to reduce the size of fibroids, and then the lady has been advised to get pregnant immediately after the use of the medication. But usually fibroids do not disappear with any medication. They will need some sort of a surgical treatment if you want to get rid of it. So these are the things to be kept in mind. I have been dealing with various fibroids of different sizes for different reasons for women. We have had successful pregnancies after the removal of the fibroids, whether it is through a laparoscopic surgery or an open surgery, and great results during pregnancy. The only thing that you should remember, if you have had a fibroid surgery, most of the time, if you're having a pregnancy afterwards, you will need to have a cesarean section, and it is not advisable many a times that you go for a normal delivery, but your doctor will be the best judge to tell you which way of delivery is the safest for you and your child. So the other causes of heavy periods can be hormonal imbalances. So this we have already mentioned in our last videos, that certain hormones like thyroid problems, prolactin hormone problems, they can cause heavy periods. Third cause of heavy period is if you are having some clotting disorders. Usually we will find that young girls who have had heavy periods right from the start of the periods will have clotting disorders, because usually these clotting disorders are genetic. So a doctor will appropriately investigate you if you are having heavy periods. Usually when you come with the problem of heavy periods, we run a few tests for you, and secondly, we organize an ultrasound scan to look for any pathology or any mass effect or any problem with the ovaries, and then we plan a treatment for you. So do not worry too much if you have heavy periods, but yes, investigation and treatment is definitely needed. So we welcome any questions. Please feel free to ask any questions about your fibroids. Visit our website for more information about fibroids, where we have given more information about how to deal with fibroids and what are the causes and what are the symptoms and what is the management of fibroids. We are giving a link for our website down below, and I hope to see you all in our next video session on the YouTube. Please stay tuned in, subscribe to our channel, and have a safe and healthy life. Thank you.